Hi, I'm Caitlin over here at TherapyWorks, and I'm joined today by Lydia Kepler, one of our awesome PTAs, to talk about elbow pain. I do want to apologize. Thank you guys so much for waiting. We are a couple minutes late, but patients come first, and sometimes you just gotta prioritize them. So, but no problem. We're here now, and thank you so much for joining us. Lydia, just to start off, the elbow pain it's among the top 10 most common conditions that we treat here at TherapyWorks. So could you tell us a little bit about why it's so common?
Honestly, it's one of our joints we use a lot, so it actually kind of can get irritated pretty easily. A lot of repetitive motions. If you think about anything with sports, we'll see a lot of people with, as far as golf and tennis, and especially regularly or lately, it's been a lot of pickleball with the moving of the wrists and everything. It's
never would have thought of pickleball. That's funny.
We have a few people. So, but yeah, same thing. You just use it a lot. Elbows have a lot to do with your hand and wrist motions. So even with computers and typing and stuff and positioning in your work, can all be affected. Elbow can get affected pretty easily.
Yeah, that makes a lot of sense. So, anytime that you start, thinking about elbow pain or even just doing basic Google searches about elbow pain, the two terms that come up a lot are golfer's elbow and tennis elbow. Could you tell us a little bit about the difference between these two, or what are they?
So both of them actually are related to the different ligaments in the elbow. And just kind of in positioning. So the tennis elbow is usually more bothered on the outside. We'll see more pain through here, where golfers is more on the inside. It's just basically on the different movements of swinging a golf club compared to tennis. Either way, they're both painful. They're both inflammation of the ligaments. You can actually have both at the same time. And it's just the biggest thing is to usually it's kind of based on weakness. And so the big thing is to try to get in and start getting some of the problems solved pretty early on. So you don't, because of weakness or tightness, end up getting tears and stuff, making it worse.
Yeah, absolutely. And I think it is good to note, just because it's called golfer's elbow or tennis elbow, that is not always what causes it. It's just common among people who do those things.
Yes, it's just one of those it's their common movement, and so it just kind of gets related that we can do it everyday things.
For sure. Like you said, typing can elbow problems.
Right.
So if someone is experiencing some elbow pain, are there some stretches that commonly are helpful that you found?
Like I said, a lot of stuff is related back to that we can do some of those stretches through the wrist. I would recommend a couple of the basic ones is we do an extension. So I'm kind of pulling with my hand here. If this was the elbow that was being affected, pulling it here. And then you kind of turn it over and can do the same thing in the other way. The nice thing is you're getting, like I said, both on the flexor side and the extension side, but you're also getting that movement of supination, kind of when you flip your hands back and forth, which is a rotation in the elbow as well.
Awesome. And I should always, I always like to jump in and mention, if any of these are causing additional pain, or if you're uncomfortable, tightness or pulling a little bit is okay. But if it crosses the line into pain, or if you're nervous that it will, don't do it. Call us, talk to us first, or, another medical professional before you continue.
Absolutely.
So, those are some good starting stretches. Are there any movements or exercises? You had mentioned the weakness can often be behind some elbow problems.
Right. Honestly, it's almost the exact same as those stretches. I've been thinking about this a little bit to just make it kind of cohesive. But if you had something that weighed a little bit, and it can even be like a soup can or something, it doesn't have to be weights, and it's definitely better to start smaller. Same movement. Sitting there, if this was weighted, pulling it up into extension. Now I'm making this muscle up here work and working on strengthening, and then turn your arm over and do wrist curls this way. And you'll feel, if you kind of try it, you'll feel it all through your forearm here.
Absolutely. I'm thinking about, people at the gym. You so often see people like working their upper arms, but very rarely do you see someone sitting there like actually working their lower arms.
Correct. And it's just something we don't think about quite as much. Yep. Yeah.
Until you have elbow pain.
Until you have problems.
And you think about it all the time.
Yes.
Yep. So I guess that kind of brings me to my next question, which is, what are some good ways to avoid elbow pain or injury?
So obviously, like I said, the strengthening is a big component, because we don't probably do as much as we should, or we don't think about it as often. The other thing is being aware, like listening to your body. If you get done doing a sport, playing a game of pickleball, and you are starting to experience some problems, you can try those stretches for a day or two. But honestly, if it's lasting too much, you do want to get it checked out. We definitely do complimentary consultations here, which is where you can kind of come in and let us know what's going on, and then we can kind of say, okay, no, yes, we can do something to help, or no, we kind of give you a direction to start, or just seeing any doctor that may be able to assist you. But I think the biggest thing is not letting it go on for too long.
Yeah, absolutely. And like you said, like I love complimentary consultations as just an option for, it can be so hard to know, like, is this something that, I should get help for? Is this something that will resolve itself? And having something that's free and not very long. They're usually about 10, 15 minutes.
Right.
And with, a physical therapy professional to just ask your questions, figure out what's going on. And, maybe the next step is, it'll probably be okay, do some stretches. Maybe the next step is physical therapy. Great, we can help you. Maybe it's, like you said, going back to your primary care physician or to another specialty.
Right.
No matter what, we can help point you in the right direction and make sure that you're on the right track so it doesn't get out of hand.
Yes, absolutely.
Yeah, so I guess kind of along that track, lots of people have elbow pain, especially, this time of year when you're like raking and stuff like that. Like, it comes up a lot. And honestly, last weekend I was over at a friend's house and holding her new baby for, hours. And I walked away and was like, oh no.
Yes. Yes.
So how do you know when it kind of crosses the line between, just kind of normal, your body's having a little bit of pain versus something that you should really seek help for?
So talk about raking, and it is definitely, it's one that's got a lot of work, raking, shoveling. Unfortunately, hopefully we don't have to do that this year, but probably stuff like that. Soreness from overexertion or doing something that's a little bit more than you're used to. 12, 18 hours, normal. Going beyond that, it's never hurts to kind of start paying attention a little bit more, seeing, because you really shouldn't be doing something that stresses the muscle for longer than that. We want to, so that would be an indication if the pain's lasting a little while longer than it should, that something might be worth being checked out. Same thing with limitations. Like if you've done something, you've played something, and you really are just having a hard time even like straightening your arm out, doing anything like that, those would be the times when you would definitely want to kind of follow up and check and see if there's anything else more you should be doing.
Yeah, that's always a big alarm bell, as if there was something that you could do before and can't do now, or you like avoid doing it now. Maybe you can get the dishes off the top shelf, but
that's painful.
You
if
avoid
it's so painful,
doing it, or you do it with the other arm. Yeah.
Agreed, absolutely.
Yeah. So, lots of great advice. And is there, anything else you'd like to add before we sign off?
No, just like I said, follow up, listen to your body. That's a big thing. Sometimes we just think that, I did something different, and it is, I probably am hurting. Really listening to your body and to figure out if it's soreness and just muscle fatigue, or if it's actual pain. That's usually a good indicator too, because a lot of us, if we stop and think about it, we can say, no, it's just sore, or actually it's kind of sharp. There's different kinds of pain feelings, but kind of listening to your gut and to tell you how to proceed.
All right, thanks so much. It was great talking to you today. And, just again, if you are, feeling elbow pain or you're, not quite sure, maybe it is time to get it checked out, maybe it's not quite yet. If you have any doubts in your mind, just give us a call. The number is 785-749-1300. And we'd love to talk to you for a complimentary consultation and just give you that peace of mind of knowing that whatever that you know what to do and you know the right steps to take to make
Mhm.
sure that your body's working for you. So thanks so much for talking
Absolutely.
with us today, Lydia.
Absolutely. Thank you.